We have a standing rule at UF that both the dogs and the cats need to volunteer, just like you and I have that choice when we go to donate our blood. And that's really a point of pride with us, is that our donors are safely donating and they're volunteering to do it.
Hey, VetFolio Voice listeners, welcome back. This episode was extra special because not only was it a throwback to my time in vet school, both in terms of my guests and our topic, but I got to sit down with said wonderful guests in person, which is my favorite way to do a podcast. Talking to both of them, it felt like no time had passed since vet school, although the reality is more time had passed than any of us sitting there were willing to admit. I was joined by Dr. Julie Wurz and Camille Kelly from the UF Blood Bank, which that was another little throwback to vet school for me because that program, it's near and dear to my heart. My Rottweiler Samson was a donor there for several years and he loved it. He would get so excited when we were pulling into the parking lot. He knew he was going to go inside and get treats and attention. He'd, "Bye, Mom." He'd take off with whoever was there to pick him up without even looking back at me. And then, for him, it was a little extra special because being in vet school, he would hang out in a run in one of the wards while I was in clinics or in class. And everybody got to know him over the years, so they would all stop by and give him treats and love. And it was just, those were the best days for him when he got to go and donate. But beyond just talking about, my dear sweet Samson, we also took the conversation beyond the UF donor program and geared it towards trying to make the use of blood products safe and accessible in general practice. We talk about how to identify and screen potential donor dogs if, say, you wanted to have a pool of staff pets or client-owned dogs who are ready to donate should the need arise. And then also being familiar with the different commercial resources that are available if you were to, say, have a planned procedure where you were concerned about blood loss and you knew it might require a transfusion and you wanted to order in blood ahead of time. We walk through the different types of blood products available and considerations around, for example, when to use whole blood versus packed cells, stored frozen plasma versus fresh frozen plasma, and then also some of the products that maybe we don't use as much in general practice, like platelet-rich plasma or cryoprecipitate or albumin and things along these lines. The goal was really to try to empower all of us out there in practice with the skills, the resources, the knowledge to be able to treat as many patients as we can, and to help equip general practices to be able to keep more of these cases in-house if that's what they want to do. Maybe there's a client who isn't able to refer for one reason or another, or there's a practice who says, I would like the opportunity to manage more of these cases in-house. The more we understand what's available and how to use it, the better we can do for our patients and the more patients we can help. So all in all, I'm sure you can tell I felt like this was a really important conversation and I had a lot of fun having it. So let me introduce my guests so we can get into our episode. Camille Kelly is the blood bank manager at the University of Florida College of Veterinary Medicine. Camille graduated with a degree in equine science from Delaware Valley University in Doylestown, Pennsylvania. After working in various practices, she joined Oradell Animal Hospital in New Jersey, where emergency and critical care became her focus. Her special interests include snakebite envenomation, feline critical care, and blood component therapy. She's passionate about mentoring veterinary nurses, supporting veterinary students in their professional development, and raising awareness about the need for canine and feline blood donors. Dr. Julie Wurz is a clinical associate professor with the University of Florida College of Veterinary Medicine and serves as a primary care veterinarian with the Primary Care and Dentistry Service and as the blood bank director at the UF Small Animal Hospital. She graduated from UF in 2002 and worked as a primary care veterinarian in Gainesville for 4 years before diverting to relief work in Alachua and surrounding counties. In 2006, she began working part-time with UF Primary Care and Dentistry, and this quickly evolved into a full-time position in 2007. And in 2008, she added working with the UF Small Animal Blood Donor Program, and in 2025 has advanced to her current position as Blood Bank Director and Primary Care and Dentistry Clinical Faculty. A lot of fun to talk to these two. Let's go ahead and get into our episode.
In the age of Dr. Google and conflicting influencer advice, it's important to follow the evidence. That's why the NAVC publishes free veterinary journals for every member of the veterinary healthcare team. Subscribe to Today's Veterinary Practice and Today's Veterinary Nurse for evidence-based clinical insights. Or check out Today's Veterinary Business for practice management guidance and deep dives on the latest industry trends. Visit navc.com and hit the Publications tab to learn more and subscribe today.
Well, in this episode, I'm joined by one of my mentors, Dr. Julie Wers from the University of Florida, and Camille Kelly, manager of the UF Blood Bank, who also helped me in vet school. And I'm so excited. We're going to talk about blood transfusions, blood donations, blood products, all things blood. So thank you both for joining me in person in the studio. I always love when I get to talk to people in person.
It's great to be here.
Yeah, it's fun. Thanks for having us.
Yes, absolutely. So let's start with maybe practitioners who are in a situation where they're not someplace like Gainesville where we have ready access to blood products, or they have a client who can't afford to refer for a transfusion, but they don't have enough demand to stock blood products. How would you recommend that practitioners in that situation kind of go about handling the patient who needs a blood transfusion?
So first and foremost is determining, is this something you have the ability to stabilize and potentially be able to transfer over to somebody who routinely does blood transfusions? Blood transfusions, it's much, much better to have a game plan before you move into them of how are we going to do monitoring, having a dedicated technician who knows what they're watching for those urticaria signs, watching for the acute paresis, which are a little bit more subtle than just somebody sitting there watching and seeing if they're going to just like fall over from a transfusion reaction. Much more dramatic, much more obvious.
Right.
And so making that decision, I would say even before that animal shows up, of is this something we want to potentially tackle? Your urgent cares and referral centers, generally speaking, are probably much more used to doing blood transfusions and hopefully have some blood product on hand, or at least know where to reach out to get it. And so if you've got that urgent case that can't wait, then comes that question of, do you have the need to have a donor on hand, or are you going to be able to stabilize the patient as much as you can and then get them where they need to go?
Yeah, I agree with that. Making a plan ahead of time, before there's a crisis is probably the best course of action. So nobody's kind of trying to do things in a panic. But a lot of smaller practices we've learned will have employee pets that they've kind of done some screening ahead of time to make sure that they would be a good candidate, and they kind of activate them in the event of an emergency. So that's an option too, or, finding clients who might be willing to use their dogs as volunteers to come in for an emergency. But yeah, so I think it's a good idea to make that plan ahead of time so everybody knows what to do.
So it sounds like what you're saying is kind of having a plan before the emergency arrives, knowing in your particular hospital how you're going to handle a patient who needs a blood transfusion, and trying to anticipate as many different criteria as you can, and then having an idea of what level of patients you're comfortable stabilizing, what the referral options are versus what you're going to try to handle in-house.
Absolutely. And part of the strategy of having that plan pre-set out is being able to do screenings for our bloodborne pathogens, doing PCR. IDEXX has a great PCR screening test. You don't have to go hunting for every single thing. It's all in there. And making sure that your donor is safe and that you're both safe for giving the blood from that animal to somebody else, but also is going to be able to safely donate that volume. And so you do need to make sure that you've got, if you're using a staff or a client-owned animal, making sure that they're an appropriate size for the volume you may need. And I would say as a GP myself, I would be comfortable doing the first transfusion. If this is an animal who's going to need multiple transfusions, that's going to also play into that decision of, do I transfuse and refer? Do I just refer right off the get-go? Because as we go through those additional transfusions, the risk factors are definitely getting higher.
Absolutely. So much to think about, which kind of speaks to your first point of wanting to have a plan beforehand. So you're not trying to make all these decisions in the moment. Let's dive into that a little bit deeper in terms of sources of blood products. I mean, we're talking a good bit about donors here, whether we have client animals or staff animals, or we keep a donor on site. ways to think about those donors? How do we make sure that those donors are safe? And how should we think about commercial sources as well? Like, if we didn't have a donor, or, maybe we were in a pinch and had a donor, now we don't anymore, whatever it may be. How would we go about getting blood products from a commercial source versus screening a donor to make sure that they're safe?
Yeah, it kind of depends on where you are in the country. So Animal Blood Resources is one of the commercial blood banks that we supplement our own in-house stock. Even with the donor population that we have, it's still not enough to support our hospital. There's Hemo Solutions is another source that I'm aware of. And there's kind of some regional ones like Blue Ridge. So if you're on the East Coast, it's kind of mid-Atlantic, they're also a great resource. So there are a handful of commercial blood banks that exist, but sometimes they're in short supply too. So it's a good idea to speak with them ahead of time, make an account, and get to learn their policies to find out, okay, how long does it take to get something shipped? What's the likelihood that you're going to have the type of product that we're looking for? Kind of make those arrangements ahead of time.
Great resources there in terms of looking into the commercial products. And I love what you said about letting that play into your plan of, if this is emergent, then how long are we talking? And, it might be a good source for, even if it can't treat the emergent patient that needs a blood transfusion right now, maybe that surgical patient that is a high risk of bleeding or something like that, where you could plan ahead a little bit. And how having that information on hand and knowing what the options are can really help facilitate keeping things in-house for either clients who don't want to or can't refer, or cases that you want to handle and you feel equipped to handle in-house.
Yeah, there are other blood banks, around like throughout the state of Florida as well, independently run hospitals that have developed their own blood bank program. So, getting to know, your local vets, should be getting to know what kind of options are around if they're not near, a big referral center. Sometimes there are some hospitals that say, hey, we do keep a couple donors, or we keep a couple units on hand, and, develop a relationship with them to, maybe have that in your back pocket.
Yeah, and those are going to be the better sources. Your local blood banks are going to be probably your better sources for, okay, I need this now.
Sure.
Blood products are not something that the average, at least when I was working in private practice, the average private practice is able to keep on hand, because it does require such specialized equipment for storing it. And so if you are pre-ordering, you want to make sure that you do have that timeline down pat, so that for your splenectomies or something like that, if that's what you want to have it there for, make sure you time your surgery for when that blood's going to be arriving, so that there's not a need for that specialized equipment for storage.
Sure. And I want to talk about the specialized equipment here in a minute. But going back to the donors, Camille, you mentioned maybe there is a local hospital or network of hospitals that may have donors. They keep screened and they have handy in cases of emergent blood transfusion. And Julie, you mentioned doing PCR to screen these donors. I'd imagine we're looking at typing and screening for different pathogens. If a hospital were to want to have some donors that they can call in case of emergency, how would they go about getting all the information they need to know this is a good donor?
So starting off with just checking an overall physical exam, making sure that we try not to get older dogs, just because of that potential for something hidden that we just didn't know about. And so making sure it's a relatively young adult who can handle having a transfusion. To date, that I know of, there's no instance of transmission of things like cancer and that sort of thing through a transfusion. I still don't want to be the one to find the first one.
Sure.
So in general, if they've got anything beyond a cyst or a lipoma, that's probably not going to be the dog I'm going to say, hey, we should have as this clinic donor.
Right.
But young, healthy, these guys, like checking a CBC, a chemistry, a urinalysis, just making sure their overall body is doing well, and then doing a blood donor PCR set. And with that, we're looking at, I'm not going to remember all of them, but we're looking for anaplasma, we're looking for ehrlichia, we're looking for all the various rickettsial diseases out there. The one that we use is the IDEX blood donor PCR panel, and they also do a 40X heartworm snap at the same time.
So you said IDEX. This is an actual blood donor panel.
Yeah, there's a code that IDEX has. It's one of their coded tests, and you can just call them up, and it's a red and a purple top, and you send that in, and they will send you back your results. And it's kind of nice having that double check with like ehrlichia of an antibody test on the snap, and then our PCRs to see how worried we need to be about it. We get both.
Antibodies, sure.
And so getting all of that in one test kit. And having that as your start point for, is this somebody healthy enough, is a good baseline. I would also recommend, just in case you're using this for somebody with like some sort of clotting disorder, we check von Willebrand's tests on all of our guys at the very beginning of them becoming a donor, because we want to make sure they've got those clotting factors for the patients that's why we're doing transfusion. And so screening that sort of thing, that's really going to be kind of the baseline. And then, as Camille was pointing out, making sure that that's somebody, both pet and owner, who in a pinch we can call and they can actually get there. And so I know when I was doing work out in the country areas, like there are some clinics that we had like 2 or 3 golden retrievers, and it was pick the golden retriever, and they had a rotation.
I love it.
And like the practice owners, that was their dogs, and they did annual screenings on them and made sure they were healthy. And that was a way, and it was, I would say it was a fairly safe way to do it, because the dogs lived on property. And so when we had an emergency come in, we were able to be like, okay, come here. It can get a little tricky, because if you have too many emergencies too quickly, you've run out of donors.
Right.
And that's where giving a call over to somebody who has a blood bank or another clinic that has a donor dog and seeing if they have something available, maybe another route to go about. So.
Yeah, that all makes sense. We do a pretty exhaustive screening process on our donors, like Dr. Wurz was talking about with PCR testing, and everything. We also do extended blood typing. So we're going to identify all of the different blood types instead of just DEA1, which is the only test that we can do in-house for.
Okay.
So sending that out gives us some more information about that kind of donor profile. And we do antibody screening as well. So some dogs are born with alloantibodies against other antigens, not DEA1, but some of the others. And so that's useful for us to know, because if that dog is antibody positive, then they're not going to be a good donor for us. And it takes about a week or so for the turnaround time for that type of testing. We use Animal Blood Resources Lab for that. But I mean, bare bones wise, if you don't have that kind of time, if you perhaps didn't have all of those planning steps, ahead, where you have a week lead time to be able to get all of that, baseline, there's an in-house blood typing kit. That's pretty easy. The Alvidia kit, we know the dog's blood type for DA1, positive or negative, in just 3 minutes. So that's quick bedside. Another quick bedside is the 4DX test. So we're gonna know if that dog, potentially has heartworms, or has any other communicable disease that we can test for in that small panel that's giving us just a fraction of information. But if we have no other option, then that is a potential choice. That would be kind of the bare minimum, but also, like Dr. Wurz said, then making sure that dog is healthy enough to be able to give that blood. So of course they're going to do a physical exam, a CBC Chem, UA, minimum database kind of stuff too. So yeah.
Yeah, all of that makes a lot of sense. I'm curious, and it's like you read my mind, because I was about to segue into equipment to have on hand. And part of what I was thinking of was typing cards and looking at typing and cross-matching and this type of thing. But now I'm curious, if we're doing extended typing on the donors, it makes sense for the alloantibodies. Actually, my dog Patches, she was not a candidate because she had alloantibodies.
Right.
She did not get to be part of the program. But when you have that extensive typing information, is that the primary reason? Because if we're typing the recipient and in-house, then we're only going to get that DEA1 positive, negative. So what additional information are we getting from the extended typing?
Yeah, so we type for DEA1, 4, 5, and 7. DEA4, like 99% of dogs are going to be positive for, so we just already acknowledged that. But DEA5 and 7, it's kind of a 50-50 on the population. If a recipient has antibodies against DEA5 or 7, and we transfuse them with a donor that is also positive for 5 or 7, there's a potential for them to have a delayed transfusion reaction. So it wouldn't be something catastrophic. It would be something that we can clinically manage. So we include donors that also have those other blood types. So we have that information then on hand. If we have a reaction or we have issues with finding a match for a donor, then I'm going to choose dogs that are negative for DEA5 or 7, assuming that that's perhaps where we're having a problem. So
interesting. Yeah, because I always think in terms of DEA1, because that's what I can learn.
It's the most antigenic, right? Yeah, it's the most antigenic. It's going to be the most likely to cause, a significant transfusion reaction. So the other ones still can, but they're going to be less severe.
Okay. That makes a lot of sense. Kind of expanding on the equipment. If we are doing transfusions in-house, I mentioned typing and cross-matching. What equipment do we need to have on hand?
So the blood typing kits that I would use are the Alvedia kits. The blood typing cards exist, but they're really subjective. If anybody that's listening has ever used them before, they're a bit too subjective, and so there's some literature that supports using the IHC kits instead. And that just takes a really small volume of VDTA whole blood to find that out. And like I said, it's just 3 minutes. So yeah, that's the typing test that I would use when you're in a pinch, and that's of course what you're going to use for your recipient screening. But if you have the time ahead, then I would submit, a complete blood typing profile through Animal Blood Resources to just get that extended typing so that you're going to know if the dog is positive for anything else. Sometimes we're lucky and a recipient has already had extended blood typing because maybe they've had issues with getting transfusions in the past. So then I'm going to already know, hey, this dog is also positive for other antigens that we wouldn't have known. We wouldn't have a bedside way to test for that otherwise. So
I have never been that lucky to have one that's been extensively tested prior to needing a blood transfusion.
Yeah, it's rare.
But good to know that it happens. I'm thinking if we have a donor collection kit and, you're mentioning typing, if we have the same blood type, are we still cross-matching these or are we saying type to type? Because I've heard it different ways. I've heard, nope, as long as we have the same type, we're going to go for it versus cross-matching. We might be talking about the cards that you were mentioning. And then I'm also thinking in terms of collection from the donor, what equipment to have on hand. And if you have any input on the quick and dirty of we meant to get this SOP up and running and we haven't done it yet. And now we have to do a blood transfusion and we have heparin and a syringe. And all right, and remember all of these questions. I was
going to say, you lost me now. The first one's already on my brain.
I'll keep these in my brain, I promise. And then you mentioned storage as well. So curious about all of that.
So in terms of basic equipment that you're going to need, for blood collection sets, there's a couple different manufacturers. We use the Terumo triple bags, which we've been happy with, but they contain CPDA, so they're going to already have the anticoagulant that you need. And it's a pretty streamlined system, and the manufacturer is happy to go over kind of step-by-step things for you too. So you're going to need that. You did mention some more about the recipient screening. So the minimum requirement for recipients for canines is going to be blood typing. If they've had a transfusion before, then that minimum requirement is elevated to be a cross-match. Okay. It takes about 3 days for the body to start developing antibodies. So if they just had a transfusion yesterday and that was their very first transfusion, you don't necessarily have to cross-match that dog. It's by around day 3 that then you would need to. For cats, it's a little bit more tricky. The cat's typing system is completely different. I know we haven't really talked about that much yet. But for cats, the minimum requirement is also typing. But if time allows and finances allow, then we should also be doing a cross-match for all feline transfusions, since there are lots of kind of novel antigens that cats have that we can't even test for. So better for us to do some testing outside the body, right, before we give it a try inside and see what happens. So
that makes sense.
Yeah. As with many things, cats are much trickier.
Yes.
And even if you're doing an A to an A, they have found novel recipients who have never had a transfusion. And so you would think they wouldn't have developed these antibodies, can naturally create them all on their own. They don't actually need the exposure.
That sounds like a cat thing.
Yeah. And so in that emergent situation where it's life or death, obviously you may move forward without getting that cross-match done, but ideally getting that cross-match in particular for cats. And if it's a planned situation for dogs, it's going to be a lot safer to do a cross-match as well. So if you're talking about your splenectomy or your thing that you've been able to have some time and be able to figure out, okay, this is what we're going to need to do, that's always going to be a safer option. And I agree with what you were saying as far as you hear all over the line. I work with internists. I work with criticalists. I can talk to every one of them, and I feel like I get a slightly different answer on how critical that, at what point does that cross-match become a absolute versus more of a, let's see how emergent this situation is and then make that decision.
That makes me feel a lot better. Yeah. I'm like, I don't think I know the answer to this. And it sounds like there isn't really a straightforward answer.
There's not an absolute set. And so kind of the pullback, and this is pulling into my internal medicine roots, is, it's always safest to do a little extra testing. And so doing your majors and your minors can be nice because it gives you that little peace of mind. And so, It's not something you can't do in general practice. When I was in general practice, I gave blood transfusions, I think, way more often than I was expecting to as a GP. And I follow the recipe on how do you do a major and minor cross match. Mm-hmm. And it takes extra time. But, at UF, when we do that, we have to call in ClinPath. Out in GP land, you can do it. You just have to have the time to be able to spin down blood from everybody, have your plasma and your red blood cells and be able to do that separation. But
we're spoiled.
Doable.
We're spoiled having a lab. Yeah.
Yeah, I know that sounds great to call ClinPath. Like, can you do this for me?
Yeah, we're very lucky to have that lab, but they do make cross-match kits these days that do make the process a lot easier. So if you're having to do it, the kits come with the step-by-step instructions and it's actually pretty readable. So that kind of thing exists now too.
So potentially something we could even have on hand. I don't know what the expiration date is and all that, but like anything, when you get in a pinch, sometimes we make exceptions to those dates. So that's really helpful in terms of understanding the recipient, collecting from the donor. With that splenectomy patient, and then I promise I will move off this topic. I just have so many questions about it. But with the splenectomy patient where we're planning ahead, we're ordering blood products, can we put that, if we get it a day beforehand, can we put that in the fridge? What do we need to think about in terms of storing that blood product?
Yeah, so it can go in the fridge. The trouble is if it's a fridge that's going to have, vaccines and other items that people are kind of opening and closing that door really frequently, then the temperature's not going to be very stable. So ideally it should be in a dedicated fridge that's going to be left closed, until that product is needed.
Maybe like your backup, like where we get the back stock of vaccines from is where we keep the blood product. How long can it stay in the fridge before we have to use it?
Yeah, it's going to have an expiration date on it, but most units are going to have about 35 days. Some have up to 42 days of expiration. Some of them are going to be shorter. Sometimes if you've called the commercial blood bank and you say, hey, I have a patient that is going to need blood tomorrow, they may send you a unit that's going to be expiring in just a few days because you told them that you're going to be using it tomorrow, So sometimes you will get a short dated unit, but you can always ask them and they'll let you know.
Okay. So as long as we can keep it at a steady temperature, then we basically just look at the expiration date and can keep it that long.
That's right.
Now let's stick with the splenectomy patient and talk about types of blood products, whole blood versus packed reds versus plasma and all the other variations out there. How do we pick the correct product for our patient?
So out in private practice, you've got it, but most of the time you're not going to have the ability to split that down. And so if the selection is more something you're going to do via your ordered product and things like that. Is it appropriate to go ahead and use whole blood for that splenectomy, that planned out dog? Sure. You just need to be very mindful of that potential for over and overhydrating essentially, because you're also giving all of that plasma. And so you've got volume overload as something in the back of your mind that you may need to do something with. And whole blood can be great for your emergent bleeding out animals because they're losing the whole thing. But if we're looking at our IMHAs, if we're looking at those guys who really all they need is the red blood cells, it's a little bit safer to be able to say, okay, let's just give the component we need.
Sure.
As opposed to including the plasma that has all the antibodies from the donor.
Well, and especially if we need those red blood cells and then transfusing whole blood, like we're probably not going to get as much bang for our buck, so to speak, because it's going to be diluted out with all the other stuff because we're not just getting the red blood cells in there.
Yeah, you're going to be giving a bigger volume with that.
Sure.
So that's one of the things to kind of bear in mind. Now, if you're doing the splenectomized dog and you have a dog who in your clinic you've determined is good to go as a donor and you do your cross match and you're like, hey, we're good. Like I said, it's absolutely appropriate. You would be able to do that. Just being mindful of like, would I do that on a cardiac case? Would I do that on somebody who I'm worried about pushing fluids on? That's going to be the one where I'm going to get a little bit more picky. Probably also not the case you're going to do that voluntary splenectomy on. But,
right.
Different ways to think about it. And then Camille, you want to talk about the other products?
Yeah, so there's red blood cell products like we were talking about. There's fresh whole blood. So that's blood that's been collected within 6 hours. So that's going to have red blood cells, plasma, and platelets. Stored whole blood is fresh whole blood that's just been put in the fridge. And the platelets become deactivated in refrigeration. We've recently learned there's some new literature that shows us that platelets are actually still active for a kind of indeterminate amount of time in the fridge. So stored whole blood may still be useful for patients that need platelets as well. There's also like increased hemostatic activity in plasma that's been refrigerated. So stored whole blood is a good product for patients who need support for blood loss and have a coagulopathy or need some oncotic support. And then there's a kind of whole host of different types of plasma products available. Fresh frozen plasma or refrigerated plasma has all of the clotting factors. That's going to be useful for cases that need all of the clotting factor replacement or might need specific ones that are in there, like, vitamin K rodenticide toxicities. Stored plasma is just old, fresh frozen plasma. So it's been sitting in the freezer for a year and you didn't end up getting around to using it. It's still going to be good for 4 more years. So 5 years total from the data collection. And that's going to be useful for some coagulopathies like hemophilia B, but it won't be good for hemophilia A since there's not going to be factor 5, 8, or von Willebrand factor in that. There's cryoprecipitate. So that's a concentrated von Willebrand factor product that we use for our dogs with von Willebrand's disease. And so we use that by transfusing them prior to their surgery and sometimes intraoperatively. And it buys us about 24 to 36, 48-ish hours of normal clotting time. So it gets us through the procedure and through their recovery period without any crazy bleeding. And then there's some platelet products like platelet concentrate that you can buy from a commercial blood bank that's a pooled platelet product. So it's going to have the most platelets possible in a small volume. So good for patients that have thrombocytopenia or thrombocytopathia and are actively bleeding. Or if you're lucky enough like we are to have access to a centrifuge, you can make platelet-rich plasma for those cases that maybe can't afford platelet concentrator or it can't get shipped in time. And then that's another kind of alternative plasma product too.
Sure. And I know the centrifuges are becoming more and more common because, platelet-rich plasma is being used for a multitude of different conditions. So not totally out of the realm of possibility that somebody might have access to a centrifuge and could create platelet-rich plasma.
Yeah, I've heard of some stories too of clinics using human blood banks and
Really?
And getting access to using their centrifuges since they have the same capability. We use the same style blood bags. It's the same type of human collection sets that we use for dogs. In some cases, you might be able to work out something like that with a local hospital to be able to use their centrifuge.
Oh, there's an idea. See, this is why we have these talks. Like we learn so much and then these resources where it's like, oh, but I don't have this. Oh, but wait, I can call so-and-so and maybe there's an option here. What about albumin products?
There is a lyophilized albumin product that's carried by one of the commercial blood banks. And that's a great option for patients that are hypoalbuminemic. So we're doing component therapy, right? We're trying to just replace the component that they need. If we try to meet that patient's requirement with fresh frozen plasma, it's going to take a huge volume and you may not have access to that volume. So it also being a lyophilized product, it's going to come in a vial with some powder and it's therefore also shelf stable for way longer because of that. So that could be a good option, to keep a vial or two on hand.
Absolutely. Yeah. And I learned that today. I love that. Hopefully I'm not the only one. I want to give you the opportunity to talk about the UF Blood Bank. It's near and dear to my heart. My Rottweiler Samson was a part of that program for years and years and years, and he absolutely loved it. He would get so excited every time we would show up at the hospital because he knew he was going to get treats, and then he would usually wait for me in one of the runs, and people got to know him after time. And so anytime they'd see him, they'd give him treats as they came by. And so he usually had to skip dinner those nights because he got so many milk bones. But yeah, like I said, near and dear to my heart. Tell us about the UF Blood Bank, from where it started to where it is now.
So the UF Blood Bank, we've had blood donors. We used to have on-site blood donors back before 2000. So we used to have a little collection of greyhounds who lived on-site, and they were our blood donors. And back in, I would say, about 1998, we had, I think it was about 5 or 6 greyhounds who lived on site. And then we also had our kitty colony that was about 5 or 6 cats who also lived on site.
They were just like this source of joy as you would go through the hallway in the new building where, because you just go through and there's this like glass wall of cats and it's like, oh, it's so fun.
The new buildings, they've got a much bigger area than
they
did
that's
then.
true.
Back in the 90s, it was more of a small picture window and you'd look in and they all had cat trees and they were all over the place. And the greyhounds, I mean, we took good care of them, obviously. They had playtime, they had interactions. And so those were our source for a number of years. And then while I was a student was when we started seeing more and more need for transfusions and having times where we honestly had just run through our crew and we weren't able to draw more blood from them safely because they just hadn't had time to essentially regenerate their own blood supply. And when that would happen, we would reach out back. Obviously, I was a student at the time, so I wasn't the one doing this, but there would be an email that would go out to, typically it was the students and the faculty on clinic, and it would be, does somebody have a dog they think could do this? And this was actually, for me, this was my introduction to the blood bank. My dog also did not make it into the actual blood donor program, but he was able to donate once to, it was actually another Roddy who needed multiple transfusions, and we didn't have a greyhound that we could help supply that with. Now, greyhounds are fabulous as blood donors because they do have that higher PCV, and so they're really like highly sought after for donor programs. That's part of why those are who we had on site. But after the Roddy who had multiple transfusions, then we started looking into building our privately owned blood donor dogs. And so I would say probably around 2002, 2004, don't quote me on the times, but in that time frame was when we started really building our population of client-owned dogs who would come in and routinely donate blood, and we'd start processing through things. It has grown exponentially in the last 6 years now. We have seen the need go up, and I would say at this point we've got at least 75 dogs who are active donors. And so it's over time, we've just kind of gradually expanded. We've expanded our cat colony as well. We are very limited with our cats on who can become a donor because they need to be very cooperative cats. We have a standing rule at UF that both the dogs and the cats need to volunteer, just like you and I have that choice when we go to donate our blood. These are volunteer dogs and volunteer cats, and so they have to be willing to do these donations without requiring sedation or requiring any sort of additional coercion beyond, we're going to give you a can of food or give you some treats at the end. And that's really a point of pride with us, is that our donors are safely donating and they're volunteering to do it. And so having that as kind of our gateway.
Did I hear you right that you're doing with the cats, you have privately owned cats that are donating?
We have just started in the last few years having some. We're very limited.
Not to the public.
Yeah. Right.
Oh, okay. I was
right
like,
now we're
where
limited
are you finding
to
these cats? Because I'm trying to picture my cat donating, and I don't think it would go.
We haven't reached out to public at this point. We are CVM.
Okay.
So it's people who work at the College of Vet Med who we've started this with. I think at this point we've got almost an equal number of the cats who live with us versus the cats who are actually privately owned. So as we get more comfortable with it, we may expand, but at this point, we're kind of limiting it to the people who we interact with on a daily basis.
Yeah, because I would imagine that could set up a lot of conversations of like, your cat is not as excited as you think they're going to be. Right.
And even within the CVM community, we have students who are like, my cat would be great. And then they come in through primary care for a normal exam. And I'm like, no,
can't do this one.
Yeah, it takes a really special cat to be able to tolerate being held in a position for a jugular venipuncture for, approximately 5 minutes is about the time that it takes for us to get our target volume. So yeah, it does take a really special cat. But that said, we have a handful of them.
And I love that that's voluntary because I've always seen the canine program as voluntary, but I think like way back, the cats used to get sedated for the blood draws.
Yeah, our cats in the colony still do.
Okay, the colony cats do get sedated for the blood draws. Okay. All right. Well, I mean, like I said, I love the program because it ends up being such a positive experience for the animals that are involved. And, I'm speaking from experience here. And so from these donors, you're taking many of the products that we just talked about, packed reds, obviously taking whole blood, but then processing it into packed reds and fresh frozen plasma and whole blood transfusions and all these different kinds of things. So, of course, we're in the Gainesville area, but I'm sure that there are programs available. And if we have listeners who are in the Gainesville area who say, either their own pet might be a good candidate, or maybe they know they have a patient who they say, oh, actually, like this would be a really great candidate. Who should we be looking for in terms of sending them your way and saying, being a donor?
Yeah. So our criteria for donors for the UF canine blood donor program are going to be pretty similar to other blood donor programs too. So not just us, but we look for dogs that are between 1 and 5. They have to be spayed or neutered. They have to have an excellent temperament. Since we talked about, the dogs are volunteering to do this. They have to be up to date on all of their vaccines, all their core vaccines. They have to be getting heartworm, flea, and tick prevention. Well, and they can never have received a blood transfusion themselves. And they can't have any history of any kind of neoplasia.
Other than you said maybe like a cyst or a lipoma or something.
If they have a cyst or a lipoma, those we've been able to be like, all right, well, fine, we can justify this.
Sure.
Anything beyond that, even a benign skin lesion that's a benign tumor, we still just don't want to take that risk.
Like you said, you don't want to find the first one.
Yeah, I don't want to be the case report on that.
No, that's fair.
So yeah. And I mean, if anybody comes up positive at any point, like we do our screening annually. And so the nice thing for clients whose dogs are amenable to this idea of being volunteer donors is they're getting that CBC chemistry, urinalysis, a fecal, a heartworm test, and all of those PCR tests. We repeat them every single year, and we rescreen just to make sure everyone's still good. And then we build forward from there. They also, anytime they come in to donate, they get a big bag of food as a thank you. And in order to help make sure that we stay negative for all those rickettsial diseases and other things, we are also providing the heartworm, flea, tick prevention, as well as intestinal parasite prevention, oftentimes using combination therapy, just like everyone else does in primary cares. But we're providing all of that at no cost to the owner.
Yeah. And that's mutually beneficial because then you get to keep your donor pool healthy and everything. But I mean, that's a huge benefit to pet owners. One, food is expensive, but certainly thinking of monthly preventatives, like it can add up after a while. So yeah, hugely beneficial to the pets, to the owners, to the patients, everybody. Yeah. I love it. And I've seen it firsthand. I think I was like in the ICU at one point and I saw my dog's picture on like the blood bag and I was like, oh, he's saving lives. Makes you feel all warm and fuzzy inside.
Yeah, it's nice. Sometimes I get to do that. I get to send an email to a client and let them know how their blood was used, obviously not using like any patient identifiers, but that brings great satisfaction to our clients to know how their dog ended up helping. One thing I left out in our inclusion criteria is the dog's weight, because that's a pretty important topic. So they do need to be at least 40 pounds. Ideally, we want them to be over 50 pounds to provide a full donation, but we can, using some kind of modified techniques with our blood bags, we can use dogs between 40 and 50 pounds to be half-pint donors. So it's going to be good for our kind of little dog recipients.
You talked about making sure that our donor was an appropriate size. What's kind of the ratio we should be looking for in terms of size of our donor to how much blood we can pull?
So kind of going back to, pulling way back to your internal medicine talks and your hematology talks, that whole 20% of blood volume is when we start getting worried about putting somebody into a hypovolemic state. And so we want to make sure we're staying below that. And so our little guys under 50, sometimes under 55, those guys are going to be more amenable to doing those half units that Camille was talking about. 50 and above, we can definitely, and we have historically pulled full units from. And we do that about every 2 months to 3 months is what we are asking from those donors. Ideally, every 2 months they come in, we get our donation, and then we let them go home. And they get to pick a toy. They're very happy about that. Similar to how Samson was well-known and well-loved, a lot of times if the donors are getting dropped off, they hang out in primary care. And definitely my techs get to know exactly who's who, and they get very attached to the donors as Camille walks them by us. So that's always kind of a nice little feel good.
Toys and snacks and love.
Toys and snacks, and one other benefit that hopefully no one needs to use, but it's there if they do, is for our blood donors, should they ever need blood, they are able to receive blood transfusions through the program, receiving the number of units that they themselves had donated. Obviously not their units,
Sure.
but there's a no charge on the actual product.
Wow.
For up to what they've donated.
Wow. Yeah. Like you said, a benefit you never hope you're going to need, but a big one.
You never want to use it, but if you need it, it is one of the things that we try to be able to provide.
Wonderful. Wonderful. Well, I'm so glad we got to talk about the program because I love the program so much. I want to say a big thank you to both of you. All the listeners got to hear me learning in real time. Like I said, hopefully I wasn't the only one, but I definitely took a lot away from this conversation. So thank you both again. Any final thoughts you want to share?
No, I mean, this has been a lot of fun. And I would say if people have questions about how to go about figuring out what they need for selections, a couple of easy peasy references that they can Google up, ISFM. They're via the Feline VMA. They've got a consensus statement on guidelines for feline transfusions. They do also have within those guidelines, they have specific drugs and doses that practitioners can use for if they need to do a blood transfusion on one of their own cats, or how much sedation drug they can use on that donor without having an issue for the recipient. So safe ways to be able to sedate for collection. So ISFM is a really good feline resource, and ACVIM has a consensus statement that you can also find. It was published in JVIM, but they actually walk through all those rickettsial diseases and which ones are more concerning, which ones are less concerning, and do a really good summary of what you need to be screening that potential donor for if you want to have somebody on hand at your clinic.
And you brought a copy of a textbook. Yes.
Yeah.
That I took a picture of and we'll probably keep on hand to kind of walk us through it. And when we get in a pinch and we're like, what did they say again?
Yeah. And Ken Yagi, who's the author of that textbook, he actually recently, specifically for cats, but for the Feline VMA, he did a 2-part series that was just published in the last 2 publications of the Feline VMA journal on how to prep for transfusions, as well as in part 2, it's giving that blood, what to watch for. And he has some really nice tear and share documents that can help you with having a tech who's trained on what they're watching for and doing that monitoring for a reaction, especially in those first 15 to 30 minutes when that transfusion reaction is most likely to be happening. And if you're able to, doing that slower volume delivery in the first couple minutes just to make sure that everything goes well. So he's got a really good paper out in the Feline VMA's articles as well.
Wonderful, wonderful. And for those keeping score at home, textbook we're talking about is the Manual of Veterinary Transfusion Medicine and Blood Banking. And Ken Yagi is one of the authors on it. And then papers through the Feline VMA. So lots of good resources. We'll link them all so that people can check them out and get all this information. Camille, I'm going to put you on the spot. Anything you want to add?
No, I think you covered it all. Yeah, I think we hit all the bases. So, yeah.
Well, thank you both for joining me.
Absolutely. It's been
fun.
Thank you, everyone, for tuning in. Dr. Wers, Camille, thank you so much for joining me. It was such a pleasure to be able to sit down with both of you in person and have this really important conversation. And hopefully we can continue conversations both around blood donations and other topics like this to help empower general practices and all of us to be able to manage our cases armed with as much information as possible. Huge thank you to everybody for tuning in. Really hope you enjoyed it. If you did enjoy this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. If you want to hear more episodes, you can click on the Education tab on the VetFolio website or find us wherever you get your podcasts. Of course, I want to hear your input on this talk. I want to hear ideas for topics you'd like to hear from us in the future. So feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, or we can connect on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.